Automated diagnosis is coming, but it will not replace the human factor. So it's coming and it's welcome. It will not be a threat, in my view, it will be an aid. What's new in dermoscopy? Well, several things. We have many advances in dermoscopy in many fields. Of course, in the field of skin cancer, melanoma and non-melanoma skin cancers, but also in the field of general dermatology, of infectious and inflammatory diseases. How early can we diagnose melanoma today? Well, very early. Anyhow, the addition of dermoscopy during the last decades was a revolution, a diagnostic revolution, because it enabled us to diagnose melanoma before it becomes clinically evident. But today, with the advances in our knowledge on morphology criteria, on dermoscopic criteria, practically we can diagnose melanoma at the earliest possible stage, which is before it invades the dermis, so melanoma in situ. We have criteria for melanoma in situ today. Some melanomas are featureless also dermoscopically. This is true. And this is why we have developed some strategies. First of all, we have monitoring. So digital monitoring is a very useful method, especially to manage patients with multiple moles, because many of those featureless melanomas can be recognized during follow-up by their change with time. And also, we do have developed strategies in order to address this problem of featureless melanomas, which are not based on morphology only, but on integrating morphology with all the relevant information from patient's history, and there are several strategies proposed. About non-melanoma skin cancer, even better. So not only can we recognize basal cell carcinoma and squamous cell carcinoma from a very, very early stage, but today, without dermatoscope, we can acquire even information on histopathologic characteristics of the tumor, which are relevant, important for our management. So really, dermoscopy helps us a lot in the field of non-melanoma skin cancer today. Slowly, there is a role for dermoscopy also in infectious diseases, in inflammatory diseases. Every day, practically, the dermoscopic criteria of a new disease are described and then established and so on. Of course, we are at the beginning. We have to learn, to investigate and learn many more things, but it seems that dermoscopy gradually acquires a role in general dermatology, and this is why we often say that the dermatoscope is the stethoscope of dermatologists. Automatic dermoscopic diagnosis, is this the future? Well, I would say that this is part of the future. It's true, many researchers, IT people, and also dermatologists work on it. There is really an interest in the topic, and already we do have some results. And I'm pretty sure that soon we will have even better results. So we will have softwares able to perform automated diagnosis with good accuracy, sensitivity and specificity. So it is a part of the future, but in my view, dermatologists should not be in any way afraid of this development for two reasons mainly. First, because even if one day we have a system like this, and even if in some way it will be applied in the clinical practice, the patient after the automated diagnosis will refer to who? To the dermatologist. So I don't think that in any way they should be afraid. And the second reason is that, as I said before, some tumors, some melanomas and some tumors in general, are featureless morphologically, and in order to recognize them, we develop strategies that are not based only on morphology, but integrating several information. So this human factor cannot be replaced by any software. So it's coming, I'm pretty sure that it's coming, and in my view, it's welcome.